Welcome to the third video of this series. I am Tanuj Kumar and I am here with my team in which we are going to discuss the effective solutions of the problem on challenges to the healthcare in India. After a lot of research, our team member has reached to this conclusion which we will be presenting in this video. In our previous videos, we have discussed the problems and after that we have shortlisted some major problems. If you have not watched the previous video, then you can watch it from the link given in the description or from the article. So please watch this video till the end and don't forget to like, share and also give your suggestions in the Google form. Let's once again see the major problems that we have shortlisted in the previous video. So let's start with the solution which will be presented by our team.
Hello everyone. Today I am showing you the implementation of my suggestions of solution over the major problems of healthcare system in India. And one of the major problems are lack of health awareness in India. I hope that my solution could reach the maximum efficiency of one's health career. I have prepared a survey of my solutions on doctors and paramedical forces like that how this suggestion will help them in their professions and daily life also. So for the solution over lack of health awareness, two doctors and psychiatrists said that one is Dr. Rajiv Mehta said that people are mostly unaware about the mental disorder they are suffering. They take it as their faith and go to quacks or religious healers. That why there is stigma attached to the word psychiatrist and physics and psychiatric disorder. And about the affordability of healthcare system in India, Dr. Samir Parekh said that the issue is critical in villages because of the high concentration of mental health specialists in urban areas. We need constructive public-private partnerships where access to mental health prevention and treatment is given to the rural population at minimal cost. Both suggestions are very useful to us. But increasing expenditure on health by 10 to 20% of India's GDP, this will help a lot as providing awareness through advertisement and social drama. Education over this should be marked essential for everyone. This step helps every children over the seriousness of health in their life. Let us take an example of early health awareness. In kids from their school, the live example are Japan, the cleanest country in the world. In Japan, kids clean their classroom every day. There are very less janitors. Almost 95% schools does not have any janitors. They also clean their washroom by themselves. Let us see a video over it.
あんまり好きじゃないんですけど、でも綺麗になる、全部が学校が綺麗になることは
一つは学校の教育活動の一環として清掃の時間っていうのを位置づけていますので、決してその罰で
¡Felicitaciones! ころをですね、自分の中から出してこうやって磨ければですね、みんなきれいになりますね。だけどそれはできないですね。だとしたら
仏壇のお掃除といったところまで全て手伝ってくれますので、本当に家族の一員としての役割を果たしていると思います。
Beautiful video. Thus, this should be implemented in India, and it will change the whole scenario of the students' behavior. In Japan, these behavior teach to kids from their home as well. Lack of such awareness and behavior from school as well makes someone very cruel and selfish. Now, let us see one another short video over the same problem of cruel behavior towards nurses and medical staff. When COVID pandemic starts in India, these are the main issues that had to be faced by medical staff. If such awareness was being there, then no one should suffer from this pandemic. Let us discuss the mental health awareness in India. According to 2015-16 National Mental Health Survey, the number of psychiatrists in the country varied from 0.05 for every 1 lakh person. In Madhya Pradesh, up to 1.2 psychiatrists is for 1 lakh person. Except for Kerala, all other states fell short of the WHO requirement. That is, at least one psychiatrist for every 1 lakh person. The survey notes that the prevalence of mental issues ranging from depression to epileptic disorders seems to be higher in urban areas because there are better reporting standards and a lower threshold for active interventions in cities. Here, Kerala is not on the list because we all know that this particular state has best literacy among all the states in India. So if education is provided over awareness, then things will almost change. So these are the solutions and implementation of these solutions in the real life of health workers and paramedical staff. Next, I will call Ayush Jha to provide his solution and implementation of the same problems, but with different aspects.
Thanks, Yashnian, for calling me. Hello, everyone. I am Ayush. Today, I am sharing the views over the two pandemic hits. The world's first one is Ebola outbreak in 2015, and the second one is the ongoing pandemic COVID-19. My views over these two videos that if these awareness can be followed effectively, then these two outbreaks would never happen. As my friend shows the importance of awareness in every person, in these videos, I will show the implementation of such behavior in one's life. These videos are based on health awareness in rural areas.
This is the story of how my village survived Ebola. Bats brought the tiny Ebola germs, too small to see, so small, yet so dangerous. Without realizing, grandfather rubbed a little blood in his eye. Ebola germs came into his body. Days went by. Then grandfather got a terrible fever and weakness. We thought it was malaria, But he was soon much worse. He had vomiting and diarrhea. His fever got even higher. I ran to get the nurse. But grandfather had already died. I was heartbroken. The nurse thought it might be Ebola, a disease caught from bush meat but which spreads from person to person. Others in our region had already died of this new disease. Unless we understood the disease and followed their rules, it could spread further and kill many more people. She explained that Ebola was in the body fluids of someone who was sick or had died of Ebola. Their sweat, tears, mucus, saliva, vomit, diarrhea, urine, breast milk, sexual fluids, and blood. When we touch a sick person's body fluids, the Ebola germs can get into small breaks in our skin or into our eyes, nose, or mouth. The Ebola germs spread into our body and make us sick. When somebody dies of Ebola, that body is much more contagious. No one should ever touch the dead body. The nurse advised us to wash our hands with soap and water right away. She contacted the trained burial team to help us bury grandfather's body safely. The burial team came. They comforted us and explained what they had to do to protect us. The team wore protective clothing that kept them safe from the dangerous germs. They sprayed grandfather's room and his body with chlorine to destroy the Ebola germs. They put his body safely away in a bag. To prevent the spread of Ebola, no one could touch the body of anyone who had died with signs of the disease. They also burned his mattress, bedding, and clothes, anything that might have his germs. All these actions made us safer. It was too great a risk to follow all our traditions, but we still honored grandfather in the time of Ebola. Our chief gathered all the villagers together after grandfather's death. He explained that it's natural for us to fear Ebola, but if we trust in our health workers and follow their rules, we could stop the disease. The nurse explained to us, when a person has symptoms such as fever, don't touch them. Get them to the treatment center right away. They will have the best chance of surviving and they won't spread Ebola. She advised us to wash our hands with soap and water many times a day. The whole village agreed to follow these rules. Since we all had close contact with grandfather, we were at risk of getting Ebola. We had to stay home. A health worker visited us every day to see whether we had fever or signs of sickness. We would show signs within 21 days if we had Ebola. Many days passed, and I thought we would all stay healthy. But one morning, I found my mother burning with fever. I knew I couldn't touch her. She was now contagious. My father came in. He told me he was taking my mother away to our uncle's house in the nearby village. He was afraid to take her to the treatment center, afraid he'd never see her again. I knew I had to stop them. I was young, but I stood up to both of them. I told them if this could be Ebola, she must go to the treatment center right away. We needed to trust in our health workers to save her, save ourselves, and save our village. I saw in their faces that they understood. Running away would only lead to more death and suffering. My mother tested positive for Ebola. They found her a bed. At first, the health workers looked scary, but I knew they wore the suits to protect themselves, and inside they were normal people like the nurse. They took good care of my mother. They gave her fluids, medicine, and food, and helped her body stay strong to fight Ebola. I missed my mother very much. But I could still talk to her on the phone. Sadly, some people in my village didn't survive, but my mother got better day by day. Soon, we were able to see her from a safe distance. One day, the nurse announced that my mother would live. Now we were safe to hug and kiss her. It was a day to celebrate. Our village followed their rules. We trusted our health workers, brought our sick for care right away, called for the safe burial team when one of our people died, and we always wash our hands with soap and water. Our village survived Ebola. Yours can too.
It clearly shows that how health awareness to that little girl protected her mother and whole family from deadly virus Ebola. Now, let's see another video of same scenario but of different virus and clarifies that how awareness and good mental health protected one's family.
The new coronavirus, too small to see, spread quickly from person to person, town to town, and country to country, to all corners of the world. Any one of us can catch it, spread it, and get sick. When a person infected with coronavirus breathes, talks, coughs, or sneezes, tiny droplets with millions of harmful viruses spread into the air and land on everything nearby. Without realizing, the viruses enter our body. We breathe them in. They land in our mouth, nose, and eyes. And we pick them up on our hands, then touch our eyes, nose, or mouth. In these ways, the viruses enter our body and infect us. Most people don't get very sick with coronavirus. We can have this virus and not know it, and easily pass it to others, who pass it to more people. In a few weeks, a whole neighborhood can get infected. Most people who get sick get better on their own, but some, especially the elderly, and people who already have illnesses, can get very sick and even die. Coronavirus spreads when people are close together. To protect ourselves and each other, we need to stay away from crowded and enclosed places and keep our distance. Wear a mask to protect others and ourselves. Keep our hands away from our face. Cover our cough or sneeze using our bent elbow. Wash our hands often and well with soap and water. And clean surfaces that are touched often with disinfectant to make them safe. We were careful, but one day my mother got sick with a fever and a constant dry cough. She was very tired and achy. We called the nurse. She said my mother could have coronavirus. Many people in our town were sick with this new virus. My mother needed to stay at home until she was completely well. To keep us safe, she had to wear a mask and stay apart from us. In case we had caught coronavirus from my mother, we had to stay home 14 days, so we wouldn't infect more people. A friend brought us food and supplies. We followed the rules. We avoided touching our faces, disinfected surfaces, washed our hands often, and kept our distance from each other. We opened windows to let in fresh air and wore masks anytime we were near my mother. days passed. My mother got well and could no longer spread the virus. We finished our 14 days of staying home. Happily, we all remained healthy. Actions we took at home with our sick mother, and when we were out in our community, helped stop the spread of coronavirus. You can follow these actions and keep yourself, your family, and your community safe too.
So, here from coronavirus or Ebola virus is just an example. Major part is that how awareness of protection from virus helps to save many lives. Both situations are very similar and both outbreaks are new, but basic knowledge of virals and discipline is only the major protection gear for both situations. These are washing hands frequently, abstinence from infected person, wearing mask, if someone is suffering from virus, etc., are the important parts in both videos. Now I would like to call Seetal for sharing his views.
Thanks, Ayush. Hello, everyone. Myself, Sital. I am here to show the major steps that have been taken by our government to the welfare of our country in healthcare system. As you know that major population are based on villages of India, so any schemes should be initiated from rural areas as well. In metro city, almost every single person are aware of basic healthcare and first aid, but in rural areas, very less awareness are there. Let me share some schemes of central government of India that are under implementation and many are implemented all over the state. Let us take a look on recent program of Modi government of Ayushman Bharat scheme. First one, Rashtriya Bal Swasthya Karyakram (RBSK) is an important initiative aiming at early identification and early intervention for children from birth to 18 years to cover 4 days, that is, defects at birth, deficiencies, diseases, development delays, including disabilities. Second one, the Rashtriya Kishor Swasthya Karyakram. The program enables all adolescents in India to realize their full potential by making informed and responsible decisions related to their health and well-being, and by accessing the services and support they need to do so. Third one, the government of India has launched Mission Indradhanush with the aim of improving coverage of immunization in the country. It aims to achieve at least 90% immunization, which will cover unvaccinated and partially vaccinated children in rural and urban areas of India. Fourth one, Pulse Polio is an immunization campaign established by the government of India to eliminate polio in India by vaccinating all children under the age of 5 years against the polio virus. Fifth one, Rashtriya Swasthya Bima Yojana is the government-run health insurance program for the Indian poor. It aims to provide health insurance coverage to the unrecognized sector workers belonging to the below poverty line, and their family members shall be beneficiaries under this scheme. Let us see one video that comprises 9 major welfare schemes for elders in India. These are the solutions which are implemented. Now I call Ayush sir.
Hello everyone, I am Ayush. Previously, we have very well documented the shortage of human capital in the public healthcare system in India. The distribution of medical staff across rural and urban areas is highly distorted, with rural areas facing severe shortages. Now, to overcome this, we come up with the most desirable solution that includes the new governance structure that needs to balance the responsibility, accountability, and flexibility. The central government needs to focus on increasing the supply of doctors and medical staff, especially in the rural areas. Now, there comes a big how the government is going to achieve this. Okay, so let me share with you all the very prototype or a kind of a model with the help of which this can be achieved. So it can be achieved basically through two means. One is through the expansion of training of physicians and health workers under the current system. Second is to expand the system itself to provide certification and training to new categories of paramedical staff focused on public health, primary and preventive care. This second category can be proved to be the most feasible and viable solution. Under this, the idea is to provide training to undergraduates in specifically primary and preventive healthcare. This could be done in a shorter period, say around 3 years, than the typical MBBS, which consists of 5 years. Now I would like to call Sapna to share the details of the survey.
Thanks, Ayush, for calling. I'm Sapna Rani. Yeah, we are saying this as we have done a survey among medical students, teachers, and doctors that it is compulsory to have a complete 5-year course of MBBS to render basic preventive healthcare service to a patient, or a 3 years focused training can do the job. And as an output, we have get that these people are pretty much convinced with the idea of short period focused training. The feasibility and viability of this alternative increases by a significant amount when applied to the rural areas. Let me explain this with the help of a step-by-step process. At first, the government should get means to recognize some of the basic best brains from the rural areas, adequately train them with a revised curriculum focusing on primary care, and incentivize them to serve the CHCs and PHCs in the rural areas. Once they worked here, gained enough experience and expertise, they can be encouraged to pursue further studies to augment their knowledge and serve as a more qualified professionals. From standpoint of people living in rural areas who are one of our stakeholders, are more likely willingly to stay in rural areas to render their services. Hence, this model can be proved effectively enough. Now I would like to call Divyanshu.
Thanks, Apnarani. I am Divyanshu Nayan. Okay, now talking about the most important factor, that is to what extent the solution is feasible. An aspiring model for this is offered by Chhattisgarh, which provide 3-year long medical training to the student from the state. It graduates when hired as rural medical assistants in government-run primary health centers, PHCs. A study by Public Health Foundation of India, PHFI, referred that the PHC run by RMAs were as good as those run by MBBS doctors in terms of the provider competence, precision practices, and patient and community satisfaction. As these three focused courses will increase the number of participants, especially among the people belonging to the rural areas, as the affordability cost is reduced by significant amount. Constantly taking feedback, particularly from the patients and the doctors, will robust this model and further contribute to its viability. So thank you. That's all from our side.
So let's come to the concluding part. In 2020, COVID pandemic has started expanding in our country, and we have started to face the challenges in healthcare system. As we discussed this problem earlier, so after thinking and analyzing the solutions or the feedback provided by you in the Google form, we came to the certain solutions which will resolve these problems. So increasing the budget on health will must minimize the problems. Also, awareness is an important factor in every field of work. So in this case, it must be provided in the school age. As we shown the video of a school in Japan, this will build a mindset of cleanliness in their early years. And the government schemes which has been implemented must be monitored strictly. So there would no any loopholes are left. As we see, there are lack of trained doctors. So there must be an expansion of training of physicians and the health workers. Also, training should be in revised curriculum. So as we presented these solutions, hope after this problem can be minimized. With this, we are ending this video here. Till then, stay tuned and share this video. Thank you.